Welcome back. Joining us now to talk about the lasting effects of COVID-19 is Dr. Lane Rolling. Dr. Rolling, glad to have you with us.
Good evening, Brittany. How are you doing this evening?
Doing a whole lot better.
Yeah.
Yeah. So, Dr. Rolling, now that the holidays have wrapped up, what are your greatest concerns going into the next few weeks?
Well, I think what's going to happen is that we're going to see a significant spike in mortality and people hospitalization, and it's going to be a complete collapse of the hospital system, especially here in the United States. It's going to be tremendous, like I've said earlier. And we're going to have a tremendous amount of people are going to have bad complications from this, the SARS-CoV virus. That's just the facts. And then, we have to also add in the new strains and stuff that are going to make it even much more worse and stuff. And so we have a long ways to go.
And so talk about the lingering effects of COVID and your expertise on how long the effects will last. I know, like myself, symptoms like headaches, smell, I'm not able to smell, still have just a little bit of my taste right now. So how long do you see that actually lasting?
Well, I think it's an important question for everybody out here in the world. How long do the symptoms last? And I think it goes down back to what we need to understand the basic. What happens? Why do you lose smell? Why do you lose taste?
Mm-hmm.
Why are you these these other problems in your body? Because you have to understand this particular virus has the ability to attach to cells. I mean, your nose cells, your lung cells, your gastrointestinal cells, your neurovascular cells, your olfactory cells that give you the ability to smell. And what happens is that when a virus like this, especially the SARS virus, attaches to a cell, it kills the cell. It actually, what we call is a lytic infection. It kills the cell. So that is why you lose smell. That is why you lose taste. That is why people have lingering headaches, or they have other complications in their gastrointestinal tract or kidney problems. And so the question you have to ask yourselves is how bad the infection is. How big was your viral load? How many cells in your nose were killed? How many cells in your mouth were killed? And that's going to determine if you're going to get your sensation back in 2 weeks, 3 weeks, 6 months to a year. And we're still early in the process of this disease and stuff, but it's just going to be a long term in understanding medicine and science.
I mean, that just makes me think about the fact that I don't know when I'm gonna be able to taste my food again, or smell it, or smell perfume, or anything like that. Like that sucks. I have to tell you the truth. So
Yeah, but
go ahead.
I was saying that's part of the process, and people don't realize that the nose and smell are one of the first symptoms that you get with the SARS-CoV virus. For yourself. And then once you lose that ability to smell, you lose your ability for appetite, your taste of food. People get nutritional deficits. People get clinical depression and stuff. And so I completely understand the spectrum. This is why it's so important that people need to understand that this SARS virus is a real game changer, not just in the global sense, but also in the medical aspects of persons that are infected, and not the short term, but the long term complications of the virus.
Right. So we know there are now vaccines out there, but since there isn't an actual cure for the disease, what do you think people with those lingering effects can actually do?
Well, I mean, the reality is that there is no treatment. The vaccination itself is still what we call EUA, it's experimental use authorization. That means the vaccine is experimental. Now you have all these different strains out here. I think the vaccine is going to be that less more effective because these viruses are distinctly different, all these mutations. But at the end of the day, what you have to do is try to do the best you can mentally, have good nutrition, take multivitamin, try healthy attitude. Try not to get into the clinical depression part where you've had the disease, you're recovering, but you still have effects on that. There are doctors that are specialists in functional medicine, doctors that can help you do rehabilitation. Some people are going to have physical therapy. Some people are going to have occupational therapy. But you're going to have the best you can possibly have, because we have a long ways to go. And that's just the bottom line. At the end of the day, it's just trying to be as proactive as you can. That's why it's so important, Brittany, that people need to remember to make sure you wear your mask. Because that mask, that nose and airway, your throat is going to be the first line of one way of getting the infection and killing your nose cells and stuff. Making sure that you continue to wash your hands, because even though you got the virus the first time, you still can get a secondary and a third infection from the same virus.
And lastly, the testing sites have been experiencing long lines of people. Is that a sign that more folks are taking this seriously? What do you think?
I think it's a combination of both, but the testing part in the future is going to be the hallmark. The testing part is going to be more important than the vaccination because it's going to give people the baseline information to understand if you're positive, have you been reinfected again. Now we have the new strain, the London strain, the B117, you have the African strain, you have the SARS mutant strain. So testing is going to be the front line of this whole pandemic over the next 4 or 5 years. And the bottom line, you have to have the most accurate test to be able to protect yourself and your family, and that has to be PCR technology. And when we say PCR, it's the most accurate, it's the most sensitive for diagnosing disease versus antigen antibody. And then with the PCR technology testing, you get real-time results within 3 to 4 hours. That's a game changer. So one of the reasons why people are really getting concerned because the mortality rate's going up. You know, we're at 350,000 people have died from the SARS-CoV virus, and I think that number's wrong. I think it's probably 400,000, and we will be at 600,000 or 700,000 by March. And so testing, and people really are starting to take it a little bit more seriously, but we have to have much more seriously because, you know, I've seen people out in public, no mask, you know, in restaurants, babies don't have masks. And so we have a long ways to go, but testing will be the foundation to mitigating and containing this disease.
Yeah, I saw a post that said, do people think that COVID took a break for the holiday? And it didn't. So again, you know, we just have to continue to take this seriously. Dr. Rolling, thank you so much for your time.
Thank you, and you have a super fantastic evening, Brittany. Bye-bye.
Next in sports, an HBCU athletic director in the MEAC talks COVID safety, plus why top recruits are now headed to black colleges. Our James Hill has that after the break. Stay with us.
And Chi-Town